right. Thank you so much, Alex. We are live on Facebook right now, so please share this with your friends. This is an opportunity for the Task Force on Racial Inequities to really the COVID-19 Task Force on Racial Inequities to talk about the 10-month journey that we've been on, the work that's happened in this community, and how we've effectively closed the disparities or helped or assisted with closing the disparities related to COVID-19. Again, I'm Isaiah Oliver, President and CEO at the Community Foundation of Greater Flint. And I'm joined by a collection of co-chairs of the Task Force on Racial Inequities that not only with the task force, but in their own respective organizations have been pushing for closing the disparities with regard to people of color impacted or disproportionately impacted by COVID-19. I'll give just a moment for folks to sign on here. As you know how Facebook Live is, you got to give people an opportunity to kind of check in. But we do have a number of individuals that are in the gallery here, about 40 people in the gallery here with us, alongside us, really looking to have some conversation about what we've been doing and what we plan to do moving forward with regard to COVID-19. And right now I'm just kind of talking and I got a whole bunch of people looking at me. It's like Jeopardy with a whole bunch of muted phones. All of these folks were just like busting at the seams a minute ago. And now I'm getting all of the stale faces. We are honored today to not only have co-chairs of many of the subcommittees of the task force, but we also have the Honorable Mayor Sheldon Neely here with us today. And so we're excited to have you with us, Mayor. I'm going to open by just talking a little bit about the establishment of the task force. So early on, the task force was established just after the community was announced that many of the issues were happening and communities started to close as a result of COVID-19. Early on, we understood the disproportionate impact on African Americans and Latinos. And the Community Foundation of Greater Flint partnered with a number of community organizations, Michigan State University's Division of Public Health, the Charles Stewart Mott Foundation, the City of Flint, thank you again, Mayor Neely, Flint and Genesee Chamber of Commerce, Hamilton Community Health Network, and Shiloh Missionary Baptist Church to launch a multi-sector group focused on addressing a multi-sector issue. The group was focused on developing policy recommendations for government, businesses, and philanthropic institutions to protect the vulnerable populations and ensure an inclusive and equitable restart to our economy. And now we did believe that we were going to restart our economy, hopefully in June or July of 2020. And our thoughts were, how do we ramp up and mobilize people to do work over a 90-day period focused on making sure we have an equitable restart to the economy. And we also do everything we can to close the disparities that existed at that time. At the establishment of the task force, the numbers were terrible, not only in the state of Michigan, but locally. And Dr. Debra Furr-Holden speaks a lot about those numbers. But while African Americans made up like 14% of the state of Michigan's population, we represented 45% of those folks that were getting COVID, but also another 50% of those fatalities. And at the local level, we were 60% or majority minority city, so 60% of the population, but again, 85% of the folks that were actually contracting COVID and 90% of the fatalities. And so when you look at numbers like that, we don't only need a state task force focused on racial disparities or the differences in the numbers. We needed a local or regional task force focused on the inequities that were perpetuating those disparities. And we needed a multi-sector group that was focused looking at 5 different areas. How do we continue to move the needle on the good work that is happening, amplify the voices of residents in the process, and engage in strategic activity to ensure we close the disparities. And the folks on this call have been actively engaged in that work, not for 3 months like we thought we would be, but for the last 10 months. With that said, I would love, I'm going to pass this over to our mayor, Mayor Neely, who has a special announcement to make today. Thank you.
Well, thank you for that, Isaiah. And I truly want to thank God for this moment and this opportunity to join with all of you and to all the participants that are watching this. I want you to take note of the faces that you see on this panel and understand that we're truly a sum of all of our parts. You see people from the business community, the philanthropic community, the health community, the education community, and we're truly a sum of all of our parts, talking about a real serious conversation and things that we have to overcome in our society, pushing back against the dominant tendencies of a nation and our society to try to make things better for all of us. And I want to commend each and every one of the people that you see here today, and also the Community Foundation for taking us on. And thank you, Isaiah. And so today, on behalf of the City of Flint and the citizens, we want to give this proclamation here. I'm not sure if you can see this. This is a wonderful proclamation put together fabulously, only because my office put it together. And we're recognizing the National Day of Racial Healing. And I want to give you a quote by one of my favorite authors, James Baldwin. And he said, "Not everything that is faced can be changed, but nothing can be changed until it is faced. And right now, we're facing the greater challenges of a society that would divide us versus putting us together. And what this task force has been doing and what this group has been doing is bringing us together, acting as a coagulant for our humanity. And so on this day, I am very proud to give and honor the National Day of Racial Healing. So therefore, Sheldon Neely, Mayor of the City of Flint, hereby proclaims Tuesday, January 21st, to be the National Day of Racial Healing. And so I present this and thank you guys, and we're going to continue to do the work together as a total society. And so thank all of you, and back to you, Isaiah.
Mayor Neely, thank you so much for this honor. It is National Day of Racial Healing. Thank you so much. You're still showing this. I hope you all can see it. We are honored to not only do this work, but to do this work in partnership with the City of Flint and the many partners that are on the stage here today. I would like to jump right into conversation, but before I do that, I would like to introduce a person who has been, I would say, my co-pilot in all of this work. Early on, we started to talk about this work with the Lieutenant Governor in the state of Michigan when they established the state's task force on racial disparities. And we knew we needed a regional task force, but we also needed some representation at the state level. And Dr. Debra Furr-Holden, alongside a few others, are actually representing Flint on that state task force. But right away, and I would say just after the announcement, she and I spent some time via Zoom, and I might or might not have been sitting on her porch while she was inside our house having a conversation about what we do at the local level and how we engage multi-sectors. How do we engage a multi-sector approach to this work? And we work through what the mission and vision might be of this work. And how do we engage new partners? And how do we mobilize individuals to do work individually and collectively? And so I'm going to introduce Dr. Debra Furr-Holden, one, to help facilitate some of this conversation, but also to offer some words about the progress we've made over the last 10 months, not only from a health perspective, but while we're also bridging the business, banking, and workforce development perspectives, while we're bridging the communications efforts, the faith efforts that exist, the education groups that are coming together. Just speak a little bit to the progress that we made as a community from your perspective.
Well, I think it's tremendous. And I do want to say, since you threw me out there, that you were the second person that I met with during the pandemic. And the first was Renee Kennedy for this, what would become state grant that we also helped to get money into Flint. And it was a socially distanced visit on my front porch, which is the only thing I said. We could either meet in the yard or we could meet on my front porch, and I have all the windows open and you can sit on one side and I can sit on one side. And that is what we did. But anyway, so, but it does point to something though, because these are just really crazy, trying times. I wasn't surprised with the disparities that we saw. If you look up to the state, and thank you for putting out the local numbers, if you dial up to the state, African-Americans are 14% of the population of Michigan, but we were 32% of cases and 41% of deaths, more than 3 times overrepresented in deaths in COVID. And people were saying things like, you know, we don't understand what's happening and what can we do? And my thing was, are you asking that question in earnest? Because if you're asking what can we do, let's take a look at what the problems are. And so the conversations that we had early, Isaiah, the thing that I really appreciate is we were committed to, one, not just dealing with these downstream things and sort of the same old way of looking at, you know, this group has more of this or that, but really looking more upstream. What are the systems and the structures and the contexts in which our people live and experience health and opportunities for health that are violated or that are inequitable for people? And how do we fix that? Because that will be the gift that'll keep on giving even once COVID has passed. So I really appreciate, you know, you sort of saying, Dad, I got to stand this up. Tell me what I don't know. Give me all that good public health 101 in language that I can, you know, that makes sense to me, where I can get our relevant partners engaged. And so we've moved the needle. In Michigan, we've eliminated the African-American disparity in both COVID cases and death. And of course, once we then drilled down and looked at our data in Flint, we had not quite as strong of a disparity because there are simply more African-Americans in Flint, but we were 1.5 times overrepresented in cases and a little bit more than that, about 1.7 times overrepresented in deaths. And now African-Americans are actually underrepresented. And lo and behold, what we found out, which is why this multi-sector approach is so important, is that much of what we saw in the excess cases among African-Americans was attributable to occupational exposure. African-Americans were just simply more likely to be forced to leave the house to earn $1 to keep the lights on than were their white counterparts. And when we dealt with that issue and all of the many other issues that they were out, but had more barriers to getting tested, were having worse experiences when they did show up at the hospital for care, were more likely to be turned away. Dealing with all of those issues, I think, required all of these sectors, and it required good science and data underneath of it. So to me, people need to be banging down our door talking about, what did y'all do? And we need to be able to tell them that with some authority.
No, thank you so much, Dr. Debra Furr-Holden. And I will tell you, if you would just join me as we have some conversation with the first group, the first set of co-chairs here today. We have Mr. Tim Herman, President and CEO of the Flint Genesee Chamber of Commerce, Mr. George Wilkinson. And George wears so many hats in this community. I have no idea which one to call on first. And so I'm going to have both of them introduce themselves. George first, because I'm not sure who you want to be today. He obviously leads an amazing business in this community, but he's also a faith leader. And he was a member of the Community Foundation of Greater Flint Board of Trustees, while also serving as chair at the time when we started many of these conversations. And so just very thankful for you and your presence, bringing your full self to every piece of the work. But just an opportunity for you all to introduce yourself, and then we'll go into some questions about progress that was made in the business banking and workforce development space.
Yeah, so I'll kick it off. I think Tim and I just gonna, I'll talk a little bit about purpose and people, and Tim, focus on objectives, and then we can talk outcomes, Isaiah, and have that interaction engagement that you desire. And I'm not going to talk about George Wilkinson, because that only takes 1 second, and you've already covered it. So I appreciate you sharing, and really. This is such important work, and so many great things have happened. This is the Business Banking and Workforce Development Committee, and again, it's to make sure that we establish an intentional process associated with identifying disparities within the business and community, workforce development community, and then closing those gaps so that we can put processes and plans in place, strategic plans in place, that we can, close those gaps, close those disparities, and be able to do what I often say, move from definition to demonstration, because there's so much work to do out there. When we first started, I will tell you that we thought that we would be able to get a lot of this done very early on. And as we started to pull together a workforce of, a subcommittee of 5 subcommittees that we have working in this Business Banking Workforce Development Committee, really to do a couple things. One, we want to focus on awareness so that the business and banking and those that are looking for opportunity from a workforce development perspective will be aware, and then that we will provide analysis and benchmarking and a scorecard and things of that nature that would be able to inform those out in the community as to where resources were, how they could develop, how could they get to where they needed to get to based upon information, and then action. I said we wanted to be intentional about really being action-oriented, action-focused, and trying to make sure that we were doing key things in order to move forward. And so though there's 5 committees. One is what we call a data committee that is really focused on making that happen. Another is what we call a business or business committee that's led by Kelfani Stevens from the city, works for the mayor. And then we have a banking committee that does what I would say is really trying to get access to capital, trying to make sure when there's grants and things of that nature that we're able to provide you with the necessary resources to eliminate those disparities. And that's led by Karen Church. And then we have Jody Curvison and Dr. Robert Matthews, who are working on workforce development in terms of mentoring programs, in terms of workforce development. And then secondly, again, connecting people with the right resources in order to close the workforce development gap. Tim, why don't you talk about objectives?
Yeah, so thanks, George. And Isaiah, thank you so much for allowing me. My eyes have been opened really wide in this process, and I really do appreciate, and I appreciate all of the members of our subcommittee. It's been really great, and George has mentioned some of them, but not all of them. I think we have a total of about 15 to 20 members on our committee, and I appreciate that. But as George said, we definitely wanted to try to capture some data. And so one of the objectives was to collect and share data regarding inequities for minority-owned businesses and entrepreneurs and workers. And we've had some good outcomes there. Ebony Gibson has been working as well with James Laney of my organization and putting together that dashboard. We're looking for resources at the time, and we're working, Isaiah, I know, with you and putting together some resources for that dashboard. Also, Kalfani Stevens, as George said, putting together an objective to review and assess capacity deployment and community integration and business support entities required to support and improve the outcomes for marginalized business owners, and really throughout that identifying grassroots or other groups that reach the target populations. And so Kalfani has been really working hard on that. He's working with Commissioner Nolden, Aurora Salcida, Tracy Joseph, and George has been helping them as well. They put together a couple of events and in August, and so they've been meeting, and we're very, very excited as to where that objective is going. Karen Church is leading another objective, and that, as George said, is to really gaining access to capital. She put together some roundtables. It was held on September 11th. Actually, local financial institutions had ELGA, LISC, Metro Community Development, Opportunity Resource Fund, Security Credit Union, and TCF Bank. And so that roundtable went well. Lots of questions, lots of answers. And also, in this whole process, we've been very, very fortunate to get grants for minority businesses. I was looking at the statistics this morning. There's been 276 grants for minority businesses in the city of Flint to a total of $1,207,000 given to small businesses, minority small businesses, and $7.8 million in Genesee County. So that just shows the great work that our financial institutions, can they do better? They admit, yes, they can do better. And with now the new PPP coming out into the community, we'll be also putting out some communications on that to make sure that everyone is informed on that. George, you want to talk about Objective 4 and 5? You're muted, George.
Yeah, so Objective 4 and 5 relate to workforce development, and I mentioned, really Jody Curtison's group is Objective 4, and they're focused on trying to develop mentoring programs, getting information out, having a scorecard that we know where the gaps are, we understand the workforce development gaps, and then ensuring that we close those gaps. And they're making substantial progress. And then finally, Dr. Robert Matthews, and he's really, doing job fairs and things of that nature with his group, trying in this virtual world, which is very difficult, but trying again to make sure that people are aware of the resources that are available to close the disparity gap as it relates to talent development within our community, and they're doing an excellent job of moving that forward. So that's where we stand currently. We obviously, if there's any questions that you would like us to entertain, we're willing to do so.
Yeah, I'll be watching the chat to see if questions pop up. But I will just want to say thank you to you, George, you, Tim, for all of the work that you all have been doing and leading this effort. And I will just ask, as we move forward, right? We talked a lot during our weekly conversation. So every Monday for about 8 months straight, we met from 10 until 11:30 as a group of 27 members to talk about the work that was happening in our individual subgroups and then collectively how we move forward, thinking that the pandemic was only the start of our need to have an equitable approach to the work that we were doing. How will this work continue as you all move forward, not only in the business banking and workforce development spectrums, but more specifically in your day-to-day work? How does this work continue to add value for you?
Well, I would, we're working at the chamber every day with small businesses, and this just goes right into what we do every single day at the chamber. And so I'm really, really excited about having these objectives incorporated in what we do every single day in our work. And I'm looking forward also to, again, having some forums, some meetings with small businesses, with our financial institutions, and that'll be coming in the next month or so as well.
Yeah, Isaiah, this work is so important that we integrate it into what we're doing on a daily basis, and it's a great question. I would say, one, especially from a workforce development perspective, that I see it at Northgate and with my peers throughout the region, that we continue to communicate and coordinate some of the things that have been identified by Dr. Matthews and by Jody, what we can use in the daily execution of our businesses in order to position people for success from a workforce development perspective. So that is going to be very helpful as we continue to develop robust processes and programs associated with workforce development. I would tell you what that third objective in terms of access to capital, access to grants, and all that is going there is key and critical for every entrepreneur within the African American and Latino community. And so, getting that information out, making sure that we get them the resources that they need in order to be successful is just critical. So don't have all the answers in terms of how we integrate that, but we're making, I think, some very good steps. And one of the things that was done was that first grassroots engagement, interaction, and forum that we had, which has to continue because there's so many barriers to entry that they are impacted by, and we want to make sure that we give them tools to execute with excellence.
And I would say, George and Isaiah, that there are three words that we have to integrate into our businesses and what we do every single day. That's urgency, being intentional, and make it a priority. And that's what we're trying to do every single day.
Urgency, intentionality, and priority. Thank you so much, George. Thank you so much, Tim, for all of the work that you all are doing to advance this work, not only in our community, but more specifically in the business banking and workforce development space. At this time, we're going to transition a bit to our friend, Adrian Walker, who is representing the government subcommittee. And as you all know, much of the work that we were doing as we talked about philanthropy's engagement and the health sector's engagement and the business banking and workforce development sector's engagement and the faith community's engagement was really about supporting state and federal government, and more specifically local government, in implementing strategies that actually ensure access to equitable outcomes for everyone in our population. And so Adrian is the more recent chair of this group, but we had a couple of other co-chairs, Egypt Otis, who was a co-chair, and Brian Larkin, who was a co-chair. But Adrian is the chair now of that committee. And Adrian, we can just take a moment, one, to talk about the work of the committee over the last 10 months, and then maybe we can engage in some conversation about the work moving forward.
Yeah, no, I'm more than happy to, and I want to thank you, Isaiah, for having me, represent the government subcommittee within this space, and thank you for all the rest of the panelists. But as you mentioned, again, for the first couple of months, I actually participated as a subcommittee member as we were headed by Brian Larkin and Egypt Otis, and government was just something that touched every single subcommittee, no matter what. So when we looked at our scope of work, we really had to figure out what is something that could have an impact in terms of whatever recommendations that we focused on. And the one of the first areas that came to mind, and mind you, again, this is months ago, but we hadn't even hit the election season, and we thought that we could have a clear advantage in terms of making sure and ensuring that people will still be able to participate within the democratic process in a safe and effective manner, understanding that, our health experts had told us that, again, potentially election days could be seen as super spreader events. So for us, one of the first things that we focused on was putting out recommendations as it relates to the importance of, yes, absentee voting. Dr. Furr-Holden joked with me because I had to talk to her within this process about, early voting, but also what does early voting look like and how you do that, as a number of people participated in that. Something that we were also, we welcomed as well as it related to the absentee voting was a different, ballot locations within the city of Flint that were community-based, where people could take their ballots if they weren't able to make it down to City Hall and drop them off. We thought that was crucial, again, for the August primary, but as well as the November election. So that was our first focus, was, again, ensuring the folks within our community, primarily, again, the African Americans, like myself, had an opportunity to participate in this process in a safe and effective manner. But Isaiah, what I will say that our work kind of pivoted to, that kind of had an impact on the rest of the subcommittees, was monitoring what was going on at each additional level. So yes, we played at the local level, but we monitored legislation at the state and at the federal level. And we were able to identify disparities that existed that I believe helped other subcommittees with the work that they were doing. Specifically, Tim and George just got done talking about the different, relationships that they were able to blend between the financial institutions and the Black-owned businesses. One of the first things that we saw within the world of government was, again, these PPP loans that initially came out. While they had good intentions behind them, it was quickly, when you looked at the data, that not everyone had equal access to those dollars due to some of the restrictions that were put on the program in terms of having, a prior existing relationship with a lot of the major institutions that, when we heard from our Black-owned businesses, they just didn't exist at that level. And noticing that, there were more iterations of the PPP program that came out that worked a lot more with the CDFIs or credit unions that, service, again, the Black-owned businesses. So it created opportunities for access to capital for that range. So that helped tremendously. And again, it helped that the work that Tim and George was doing in terms of connecting the Black-owned businesses with the financial institutions and understanding the barriers for access on both ends. Another thing that I would mention is that, towards kind of more so towards recently, we had an opportunity to bring in our United States Senator Gary Peters into the conversation. Senator Peters, currently as it stands, he was the ranking member on the Government Affairs and Homeland Security Committee within the Senate that had jurisdiction over PPE that our community, along with a number of others, were, again, fighting for as it relates to the response to the pandemic and how our communities are adjusting. Having him come in and kind of preview what's going on in DC at the time and kind of give us a heads up on the things that we should be thinking about, we believe was crucial in terms of informing the work of the subcommittee. So again, from the election to, the PPP program to the PPE that's going on, we had a number of different points of connection that we believe informed the committee as a whole about the work that's going on.
Adrian, thank you so much, one, for that overview. And if you don't mind, if I ask a couple of questions as we just kind of move through. One, could you just talk through the diversity of that group of folks that came together initially as the government subcommittee? Just, I mean, you don't have to say specific names, but just so people know who was coming together, having these conversations and pushing the conversation.
Oh man, it was an amazing group. As I mentioned, you had Brian Larkin, who at the time was at City Hall as the chief of staff. You had Egypt Otis, who's a local entrepreneur, and then you had Linda Poley, who's an attorney, and Linda brought an amazing perspective into the space. She actually was the one who drafted a lot of the language in the resolution that we put out around the elections. You had Casey Lester, who at the time was the president of the Flint School Board, and then you also had Kimberly Roberson from the Mott Foundation. So and of course, along with myself, so you had business, philanthropy, education, government, entrepreneurship at the table, talking again about how we approach the world of government.
No, that's amazing. And so I guess if we had to think about the future and what the future looks like of this work, obviously we've been thinking about what it means to shift from a task force focused on COVID-19 disparities or inequities and really move into thinking about what a racial equity roundtable might look like in this community and what its purpose might be. What might be the role? And I'll ask this question while also kind of prefacing your new role as a member of the Flint Community School Board, really operating in that governance space in government. What do you feel like the role will be of a committee like this focused on inequities that are being perpetuated? What do you think the role might be?
So I think it's interesting, right? I think I will say this, as a political scientist, we are always taught that all politics are local. However, we can't ignore that there's a change in the administration tomorrow, right? So there's going to be a change as it relates to how, the government will respond to this pandemic. I think it's up to us to ensure and to continue to advocate that we're a part of not only the relief, but the recovery plan, right? So we need to be monitoring the first 100 days of this administration and making sure that we're looking at the policies that's coming out and seeing not only how does that flow through the state, but how does that reach us at the local level? And what does that mean for our local communities, again, moving forward? We know that there's going to be a different approach, again, to policy, but it's up to us to be able to interpret that and, again, be able to communicate that to community about what this means. And, again, if we identify that we are left out of the equation, we need to hold our elected officials' feet to the fire in terms of making sure that, again, their approaches to recovery continues to keep us at the center.
Adrian, I just want to take a moment to thank you for all of the work that you're doing, not only in this space, but in our community. Again, good luck to you and your future as a board member of the Flint Community School Board, from one past community school board member to another. Good luck in all of that work. We look forward to all of the work that not only you're doing in that space, but the work that you're doing with the government subcommittee. And now we're going to pivot to another group. We always talk about faith, the faith community and their role in supporting the work that's been happening ongoing. We typically lean to our faith community when things get difficult. When things get difficult and we turn to wonder, we really lean to folks to help us to unpack those things that we're wondering about. Why did this happen? Why is it happening? How do we move forward? And so Pastor Monica Villarreal and Pastor Daniel Moore have been leading our faith subcommittee as co-chairs for the last 10 months. They've been engaged in a number of pieces of work and a number of different initiatives. And so one, welcome Pastor Villarreal. And then two, I'll just ask you if you can walk through some of the efforts that you all have been engaged in over the last 10 months, and then maybe we move to a couple of questions at the close of that.
Yeah, thank you so much, Isaiah. I want to begin by saying we can do nothing without faith. We know that for our lives, we have lived that in our community time and time again. In moments of crisis, we lean on faith, a faith that is strong, a faith that is a sure foundation. And the faith community in this COVID-19 pandemic has again risen to the occasion of leadership, of communication, of partnership building. And it's been a really exciting team to work with. So first and foremost, I want to give thanks to God, right? Who I think divinely made this possible to bring together the formation of the COVID-19 task force for our county that set forth a vision to have a multi-sector approach and really drawing us perhaps out of the silos and into those deeper community partnerships. Our work on the faith community is really grounded in Dr. King's vision of a beloved community. And I want to share I want to begin also by sharing what that beloved community entails. Dr. King's beloved community is a global vision in which all people can share in the wealth of the earth. In a beloved community, poverty, hunger, and homelessness will not be tolerated because international standards of human decency will not allow it. Racism and all forms of discrimination, bigotry, and prejudice will be replaced by an all-inclusive spirit of sisterhood and brotherhood. It is this vision and theological foundation that the Faith Committee has been engaged in our work. We've supported several initiatives in the community. One of those was the creation of a faith community toolkit in partnership with the Genesee County Health Department to provide messaging and information support, especially early on in the COVID-19 pandemic, through our channels into the faith community, to have dialogue with clergy who are engaged in their congregations and how to protect themselves, their parishioners, and the community. This has been a very important project because for the first time we have the most up-to-date and inclusive database list of all faith communities in Genesee County. This will help us in communications now and into the future. As the team continued to be leaned on for a variety of projects, we moved then to look at the effects of racism in our community. And with the leadership of Dr. Kent Key, who is one of our team members, this community worked hard to pass a resolution at the Board of Health and at the county commissioners level, stating that racism is a public health crisis. Operationalizing that resolution is where we have strategized our time and our energies. We have pulled together multiple research projects that will help us get at developing a strategic plan for our county to operationalize this resolution. If we are really to do anything that helps our community, we must get at the root, and the root is racism exists. We have to address racism. It underlines and undergirds the disparities that we have seen in people's access to healthcare. It underlines and undergirds the disparities we see in outcomes in all sectors, which is why this task force got put together to begin with, was so that we are engaging on these issues at all levels. I want to share that there are opportunities for our community to engage. We're having and holding courageous conversations in the community. Our next conversation will be January 26th from 5:30 to 7:30, and we will post, I'm hoping on the website for the foundation, the flyer that has the registration link. It's important that we all participate in our capacity to be a part of our future together. As Dr. King said, we are all inescapably woven in one destiny. The conversations called the dialogue are led by Community Roots with brothers Todd Womack, brother Sylvester Jones Jr., brother Patrick McNeil, and brother Willie Smith. These are well-known and respected leaders in our community, and we're so blessed that they have taken on this courageous work to hold dialogues. These dialogues will help inform the strategic plan to how to tackle racism in our county. In addition, we will hold focus groups come the spring. That work is led by Dr. Lisa Laprousse and Dr. Kent Key to help us further develop plans. We work very closely with the health department on all things related to messaging, to COVID-19 vaccines, and the important role that the faith community has in being trusted public servants and public leaders in our community. As it has been and probably always will be, because the faith community rises to the occasion, it is we who hold and give that certain hope in our community, that we will continue to be engaged in all things that are a need in our community, and we always are seeking partnerships, particularly as we move to the vaccine, to make the vaccine accessible and readily available to all members of our community. We're fighting we're fighting to get equality under the law and equity in all things. We look forward to engaging with our community on these issues, and there will be certainly more forthcoming as we continue this work.
Thank you so much, Pastor Villarreal. If you don't mind if I ask a couple of questions. First question is just, what in what ways can other folks that are in the faith community across Genesee County be more engaged in this work that you all are doing?
Awesome. Yeah. Dr. Moore from Shiloh Missionary Baptist Church is my co-chair. Reach out to either of us or any members on our team if you know who the members on our team. We're always looking to expand the team. We're always looking for folks who are interested to engage, who want to connect their congregations deeper. And I should say that we were very intentional from the outset that the team is multi-faith. So we are Christian, Jewish, Muslim, and we're looking to expand into other, we're welcoming all is really the message. And so if anyone is interested in joining, you do not have to be a congregational pastor. You just a person of faith who wants to engage their congregation and community more deeply and widely.
Thank you so much, Pastor Villarreal, and thank you so much for the work that you do in leading this work for our community. We truly appreciate you. And now we're going to transition to a bit of conversation with Mr. Chris Bertley. Chris, if you can come off of, there we have it. So Chris Bertley has been the chair for, and he's the only chair that doesn't have a co-chair. So Chris Bertley has been the chair for the Philanthropic Subcommittee for the last 10 months. We are excited to have him with us today to maybe walk through some of the things that the Philanthropic Subcommittee kind of talked about and discussed, and maybe even some of the interventions that were funded. And so, Chris Bertley, if you can just start by just telling us a little bit about the Philanthropic Subcommittee, the makeup of that group, and then maybe the work that we've been driving.
Well, I'll start by saying I don't need a co-chair because I have you. So, that's very helpful to have on my committee. So, like Isaiah said, my name is Chris Bertley. I am the chair of the Philanthropy Subcommittee on our COVID task force in Flint. And, I think we approach this work like all the other committees, just seeing a couple questions. What are the issues and how can we help, quite simply? And I think that question and just kind of effort and reflection took us on a path that I think none of us really could tell, starting off, of course, just trying to understand COVID and trying to understand its impact on all of the areas of our community and people disproportionately that is impacting, and seeing where government, where business, where faith, where all of our efforts can pitch in, and where does philanthropy fill in with that. I think also it took us on a turn of racial reflection as well, because during our time on the task force, not only did we see COVID's impact on Black and Brown communities, especially initially, disproportionately impact people, we saw the racial issues in our own country, and it caused us to really reflect on our organizations, on our missions, and what we could do. And so I think that the racial protests and just issues in the country, along with COVID, I think really caused us to reflect and shift some of the focus of our philanthropy subcommittee. So a lot of our work has been focused on a couple of areas of just, of course, where can our efforts go to help ensure that COVID isn't impacting Black and Brown people disproportionately? What type of funding can we provide? What type of facilitation and efforts can we do to make sure that the Flint area has access to funds that, for example, CARES Act funding, and also the funding that each of the organizations that are represented has, is using the community and making sure that we're getting input from the other members of the task force to ensure that the money's being used in a proper way, and we're finding shovel-ready projects and high-impact projects instantly. And I think the other part, which is more long-term, which I think we've been focused on a lot more now, is just what are the inequities that we see in the communities that also are present in our own organizations. I mean, I think a task force like this, the community instills and expects us to, of course, help and reflect their opinions, but I think we'd be short-sighted if we didn't think that those same inequities and issues that individuals have and biases that people have are reflected in organizations that we work, because we're people that are in the organization. So a lot of our work has shifted into ensuring that Black and Brown people in the Flint area are represented in our own organizations, and the structural issues that we know are present in society aren't reiterated and occurring in our own organizations, and how we fund, and then also how we select people to work in our organizations, and creating pipelines. So the last few months especially has shifted into making sure that we have accountability, and we have very pointed and purposeful ways to ensure that we're recruiting, we're retaining talent from all sectors, including minority sectors, and that we are granting in a way that isn't biased. And I think that that is something that I think, seeing how COVID has impacted our society, and seeing the racial inequities has really impacted people on the subcommittee, and we're working to try to address that.
Thank you so much, Chris. And so what I would love for you to do, I probably have two questions for you. One, if you could just elaborate a bit on not only the traditional philanthropy that has been engaged in the process, so the Ruth Mott Foundation, the Charles Stewart Mott Foundation, the United Way, the Community Foundation. You also took it upon yourself during this time to establish a fund focused on Black leadership development and support during COVID. Could you just talk a little bit why you and your family made that decision?
Right. Yeah. And I think for me, I am, I think when people think of philanthropy, especially in Flint and around the state, we think of very rich people, rich organizations, and they basically decide what goes on. And I think that the true philanthropy and true impact comes from regular people who are in touch and engaged with the community in ways that big organizations often cannot do. And they need those people and individuals to be able to impact the communities that they live in. So, of course, on our committee represented is the United Way, Charles Stewart Mott Foundation, Ruth Mott Foundation, Community Foundation of Greater Flint, of course, that Isaiah represents. But also I had the opportunity to represent my organization, which is a fund within the Community Foundation, which was named after my dad and my father, Dr. Nat Bertley, who passed from COVID in April. And I think just going through especially now we're approaching 400,000 people in our country who have died from COVID. I think that I really, and my family, we wanted to do something, and we didn't know what to do, but we knew that he worked as the first African-American superintendent in Flint. He impacted a lot of people, and we're grateful for the way the community impacted and changed him, and he loved this community greatly. And we wanted to do something, and we knew people couldn't grieve, they couldn't come to a funeral in the traditional way. They couldn't do the things that were really helpful, I think, for people to process. And we wanted to do something that highlighted the work that he did and could pass it forward. So we were able to work with the Community Foundation to create a fund. The fund's doing very, very well. We're very purposeful with the type of things that we want to grant that reflect leadership development, racial inequity, and education, especially from people from backgrounds like my dad came from the first generation, he was a first generation middle school graduate, so I mean, I think that's the type of work that is being done in Flint, and that I think not only needs to be funded, but needs to be funded by people and with people that have gone through similar issues and can relate and can bring the intangibles of the networks and relationships and the reoccurring, I think, impact that direct philanthropy from local people does. And so that's what we're aiming to do. We're gearing up to do our first grant in August, which we're very, very excited about. Organizing this, I think, and fundraising through a pandemic is difficult, but it's been just incredibly successful, and we're very excited. And, I don't know much about philanthropy. I've learned over the last year. So I think it's gone off to a good start. I've been working with fantastic people who have been very supportive on the Philanthropy Subcommittee and in the greater task force, of course, as well. So I'm learning. I've learned a ton, and I think that's one thing I've really enjoyed about the process is that philanthropy is about learning from people's experiences and your experiences and seeing where you can help others and magnify what you're doing. So no one person has a monopoly on what should be done. And there's a lot of consensus building and understanding that goes into operationalizing what you want to do. And I think we've seen that with how the subcommittee's been able to steer resources and get people on the same page to magnify its impact. And I hope to do that too through the fund over time.
Yeah. Thank you so much, Chris. One, thank you for your time here today, but thank you also for the efforts over the last 10 months, and then the efforts of your family, which has spanned generations. And so we truly appreciate you. And as we think about the work of philanthropy, and I always say when I'm describing the work that we do in this space, is that Community Foundation's role is to engage people in the art of philanthropy, giving time and talent and treasure. And over the last 10 months, we have benefited not only from the treasure of communities, but really from the time and talent of amazing health practitioners that understand the work both on an acute or clinical, from a clinical perspective, but also from a public health perspective. And so I'm going to invite Dr. Lawrence Reynolds and Dr. Debra Furr-Holden to join me now as we move to this last subcommittee. And so again, you've heard from the Faith Subcommittee, you've heard from the Business Banking and Workforce Development Subcommittee, you've heard from the Government Subcommittee, and you've heard from the Philanthropic Subcommittee. But one of the most important subcommittees, as you can imagine, as we engage in this work about the health of our community, was our Health Subcommittee. And it was not only the biggest subcommittee, but it was the anchor to many of the decisions that were made on the philanthropic end, guiding many of the faith conversations that were happening, the resolutions that came out of the Government Subcommittee, and quite frankly, pushing quite a bit on the work that was happening with the Business Banking and Workforce Development Committee. And so that said, I'm going to invite again Dr. Reynolds and Dr. Furr-Holden to join me as we facilitate some conversations with Kirk Smith from the Greater Flint Health Coalition and Clarence Pierce from Hamilton Community Health Network. And so thank you all for joining. But I'm also going to throw this a bit. I'm going to throw the alley-oop up to Debra to kind of start this conversation, because health again was center and important, but it had to include a multi-sector approach in order for us to really yield the results that we've described.
Well, and it's not the only sector. And if you go back to the graphic that Dr. Reynolds and all of us love, that look at the multiple layers of protection and multiple layers for pandemic response. The individual personal responsibility actions and the things that are actually linked to health are just a few of the slices. It's equally as important that people have the opportunity, for example, to actually shelter in place. It's important because kids are not in school, that they have access to good enough Wi-Fi to allow them to be able to learn remotely. It's important that people be able to keep the lights on in their homes if they're not working. You know, we had a stay of eviction in the state of Michigan. It was a stay. It didn't excuse the money. It didn't forgive the money. And when that stay got lifted, guess what? All that money came due. All that money came due. And for a lot of people, that money came due plus the fees of not being able to pay it on time. Now, the state did some things, incentivized people to not operate that way. But my point is, we've now learned dealing with the health crisis is not just a problem for the health sector. We're seeing now with the vaccine, getting that vaccine from the places where it's produced by these pharmaceutical companies and into somebody's arms requires so many sectors, requires so much planning, so much coordination. So I really think this is the right approach, because health and maintaining people's health cuts across and touches so many segments and sectors of what makes our world go round. So I was really happy to hear, and I did take some great notes about some things that I didn't even know had gotten accomplished. And it was nice to hear it as an epidemiologist and a data person. People have real data behind what they're saying. It was really powerful to me to hear the business sector talk about exactly how much money they rolled out and when. We want to be able to line that up with the progress that we made, how that helped us turn the tides. Because when we're out of COVID, do we feel a similar sense of urgency around community violence, around hypertension, around cancer, around cardiovascular disease? We've got a model now that I think has a lot of potential. So I'll stop there, because I'm sure Kirk Smith is going to be like, well, duh. So I'll look on my screen. Kirk's right here. I'll drop it down to my man, Kirk.
All right.
So Deb, I'm really, really glad you said that, because I think so many times when we think about health, we automatically go to, do I have a doctor? Do I have insurance? Do I have a doctor? Do I have insurance? But when you really look at what creates a health outcome for a community, for a person, it's those factors, and roughly half of it, like income and employment and housing, those are health issues. If you don't have income and you can't have food or you don't have shelter, you will have health problems and you will not be able to prioritize all those other issues. And Deb, you're just totally right in that. And I think much of what we talk about in health, I think, is broader, and it's more well known that these other issues are really linked to what we have seen with COVID disparities. And ideally, we can get through that and start to focus on these larger systemic issues, you know, for the years and years ahead. With the health subcommittee, and I'll ask Clarence Pierce to help me out with this as well. But I think what we've really been focused on is, in a pandemic without a national plan, from the health subcommittee perspective, what we've really had to do is focus on what we can do right now in this community without a national plan, without the resources that communities require. So we've met roughly 30 times since March. And I think every single agenda we have had has reinforced a focus on creating equitable access and capacity for things like healthcare and testing, while also working on those other issues that you've alluded to. We've tried to be very intentional about lifting local efforts to address inequities to the best of our ability, especially in a time when we're all learning about the pandemic. The information changes with COVID from each week to month. And that's hard for health professionals to figure out, just as hard as it is for community to figure out. So how can we gather that information and share it readily? For us, that right now focus has really been in 4 big areas. First off has been creating equitable access to testing for all residents, and doing that without barriers to cost or coverage or transportation. Second, we've really tried to focus on that public health education piece. Against a new disease, we learn about it on the fly. Information changes every week or within the week, and focus heavily on gathering the best and most recent information so that we can share it openly and continuously. Michigan State University's provided us a great forum every Friday at noon to do that. And that's been a real added piece to the puzzle. That's something that I hope we continue for some time to come. I think the other thing we've really realized is, again, we've always focused on, do you have access to care? Do you have coverage to get that care? Well, what happens when you're scared to go get care? So acknowledging the trauma that comes with the pandemic, the lack of trust or fear to going to get a regular healthcare service, not to avoid care that you really need, has been a focus of ours. It's meant the need to not only collaborate on new modes of delivery like telehealth or virtual mental health visits, but to actually provide regular community education to share how healthcare systems have established safety protocols to bring knowledge and comfort that would answer questions, encourage residents not to delay utilization of care. If you have emergency care, chronic conditions, or injuries or mental health needs, don't avoid that. You need that care, don't wait. And lastly, just building capacity to support residents to navigate resources and wraparound services, integrating those services, providing navigators, but doing that into the places where people will go when a lot of things aren't open the way they typically would, and providing venues for which people can ask for help and get that support they need to access resources, again, for food, housing, transportation, other resource barriers in addition to coverage and care. Mr. Pierce, you want to pick up from there with some of the things from your lens and from the Hamilton perspective, please do.
Well, thank you, Kurt and Isaiah. I think you covered a great deal of it, Kurt. But the thing that has really impressed me about the work we have done as a health subcommittee and focusing on the racial inequities within this community, pulling all of our resources together, giving us a megaphone, giving us the ability to work with other agencies and other organizations to get the word out. So many times in this business, the most vulnerable are kind of left behind. They aren't really thought of until sort of like the last of any type of thing that's going on. And this gives us an opportunity to really push them up to the top and focus on what we can do to eliminate those inequities that typically we deal with in this patient population. I think now we're starting to move into another phase where we're dealing with the COVID vaccines. And as you pointed out, Kurt, the distribution of this vaccine has really been abysmal. Uh, it hasn't worked well. I know we have started the process with our staff, but in terms of the general population, we're not sure where that's going. We're not sure if we're going to be able to get the vaccine to start to deal with uh, vaccinating the rest of the community. So I think that this committee is bringing a lot of these issues to the forefront, and it's so important, and yes, we're focused on these inequities right now, and it's all around COVID-19. But when you talk about infant mortality and you talk about low birth weight babies, particularly within the African American community, something that we've been dealing with for years, and we still have not been able to address it. That is a focus that we here at Hamilton are focused on as we go forward. Yes, it's great that we are focused on the COVID-19 because it is an immediate problem that we have to address, but we must deal with some of these other uh, systemic issues as it relates to health as we go forward within the African American community. So again, it's been great working with everyone, uh, and it's wonderful that we would tackle something like this. And Isaiah, you and the Community Foundation, thank you guys for tackling it and all of our subcommittees. Uh, and we just look forward to doing some greater things as we go forward with our subcommittee.
Yeah, thank you, Kirk, and thank you, Clarence. And I know I'm not supposed to be facilitating now, but I will say this. I want to get Dr. Reynolds in here. He always drops jewels on us, not only about where we are, but where we need to go. And just this morning, as I was preparing for this conversation, he dropped a couple of jewels and a couple of questions that help us to not only think about the work that we're doing in this moment, but the work that we're doing and how that work will propel us into the future of additional inequities that we know are playing out, or work that needs to happen. So Dr. Reynolds, if you will, just kind of enlighten the group and push us all a little bit to think about what this work looks like in the future and the challenge.
Oh, yes. Can you hear me?
I can.
All right. I'd like to share with you a quote from an Indian novelist, and I'm not going to slaughter his first name. Last name is Roy. And he said, the pandemic is a portal, a gateway between one world and the next. We can choose to walk through it, dragging the carcasses of our prejudice and hatred, our avarice, our dead rivers and smoky skies behind us. Or we can walk through lightly with little luggage, ready to imagine another world and ready to fight for it. And this is our challenge during this pandemic. Whatever was wrong in our healthcare system, whatever was wrong in our economy, whatever was wrong in our society, it was highlighted, but also this pandemic made these things worse because we were standing on a shaky foundation. And to that, I might also add, the Flint water crisis was just a dress rehearsal for what we had to deal with this year and probably most of the next 2 years. We learned how to cooperate in different sectors in ways that we never did before. We also learned how to take advantage of some of the foundational projects that we had worked on. We had a multi-sector organization that did respond to data and had been collecting data. So we kind of knew, we knew the lay of our land if no one else did in this community. And we also had federally qualified health centers. And I'm saying we built on a foundation of some of the things that we did right that could have been stronger had we stuck to our moral guns and looked at things like health equity, the social determinants of health. And we valued life over just economic recovery, because the question was economic recovery for whom? Was it for the community, all members of the community, that benefited only a few? So this remains our challenge, because if we don't get it right, we may not be ready for the next pandemic. And as we saw last week, whatever was present since the founding of this country and through the Civil War was exacerbated by this pandemic. So we have to rise to the challenge and leave those carcasses, that refuse, that hate, that greed, that avarice. We've got to leave it behind. Let the church say amen.
Amen.
You know what, Dr. Reynolds, you have a way of closing us out that not only points to the work that we're doing today, but the future work, the future challenges that we have in the future. So, I mean, the future challenges that we have. So thank you so much. Dr. Debra, because you have been my co-pilot in this work all along, I'll allow you the opportunity to have a final word.
Oh man, I'm used to having to steal the last word, not be handed it. No, I think it's awesome work. And I'll just say this, one of the things that's happened for me personally during COVID is I've gotten to know and interact with people in ways that I hadn't before. I cried on my first Zoom ever on a call with our health subcommittee. If I had to go through this journey with anybody else, I'm happy that it was with the folks that are there. I've gotten related to people in a way. I've learned things about myself. I've learned things about how I work. I've learned things about how others work. I just see this as an opportunity. Kirk, kind of said it as well. We're doing what we're doing around COVID, but the opportunity is well beyond COVID. And I know this isn't new for a lot of us. We've already been in the fight of doing this work. But I can just say for me personally, the thing that's been the most rewarding about it is to do it with the people I've been doing with. I know the same Debra Furr-Holden that came in, I'm not coming out of COVID, and I've evolved and transformed in this process. I feel more powerful, more competent, more capable, and I really have a sense of the power and the capacity and the real strengths of many partners, many of whom I wouldn't have gotten to know or interact with but for this experience. So I wish there would have been some other way for us to get here, because if I had known pre-COVID what I know now, maybe we could have even stopped it from getting as bad as it did in Flint. But I have a lot of hope here, and I feel good about the partners and the work.
Well, I'm thankful so much to you, but more specifically, you, Kirk, you, Clarence, for co-chairing, Pastor Monica and Pastor Moore for co-chairing, Adrian Walker, but I'll also say Brian Larkin and Egypt Otis for co-chairing, George Wilkinson and Tim Herman for co-chairing. Thank you all so much for the work that you put into this. And I could not, I'd be remiss if I didn't say thank you to Chris Bertley for chairing all along with a whole bunch of philanthropic leaders. If you know our work, we tend to know exactly where we're headed and how we're going to get there, and to have someone to ground us in what community's thinking and how do we engage community appropriately in our work, and also be thoughtful about all of the health related implications that Dr. Debra Furr-Holden and Reverend Dr. Lawrence Reynolds reminds us of consistently. I'm so thankful for the opportunity to work with you all. I'm looking forward to the work that we're going to do moving forward. I think what we've all learned throughout this process is this is not just today's work. This is tomorrow's work, and we're learning and growing into it. So again, thank you all. Thank you to all of those folks that are listening alongside us. And we look forward to you all joining us in this work as well. Have a nice evening. And Alex, you can actually close us out.